Makers on Capitol Hill, as we mentioned, are spending their second day focused on the future of health care here in America. Joining us now live to break it down, we welcome back our good friend Dr. Marc Clauson from Cedarville University to talk about what has happened so far and what could happen next. And you'll notice when we take the close-up, he's wearing his Constitution necktie, which you may have to refer to as we try to figure out what's going on here. It's been pretty wild so far. We didn't expect the Democrats to support this, but the lack of Republican support has really been something.
Yeah, what's happened is the moderate Republicans are afraid there will be too many people who won't continue to get coverage, and the conservative Republicans are afraid there aren't enough market initiatives, competitive initiatives in this new bill. And so neither side there is happy. The only people who are happy right now are the leadership.
Yeah, a lot of people coming out against it. The AMA today, the American Medical Association, issued a very strong statement not supporting this. And of course, there was some strong language on Capitol Hill today. We've got a second proposal, I guess, was brought out today by our own Jim Jordan, an Ohio congressman. Mostly repeal-based.
Yes.
He's focusing more on repeal as opposed to the replace aspect.
Yes, the promise, Donald Trump's promise, was to repeal. That's what most conservatives expected to happen. If you read the bill, which unfortunately or fortunately I did, you'll see that it's not a repeal. It's actually an amendment, amendment of various parts of the existing bill. And so Jordan, along with the Freedom Caucus, wants to bring out a bill that would actually repeal and then replace after a wholesale repeal.
The way this is structured, and it's very complicated, we clearly can't cover it here in 3 minutes, but the basic necessity is that you get enough healthy people joining up to the percentage of maybe like 80% to basically, you know, carry the water of the 20% of the people who will actually need the coverage. A lot of people are saying that cannot be accomplished under this proposal. What are your thoughts? Under
this proposal, it might not, and for this reason. Since subsidies will be given still in the form of tax deductions, and since there will still be pre-existing conditions allowed, that means that some people inevitably are going to have to subsidize other people. Come through the tax system this time, not through a mandate as it did before, but it still is going to happen that way.
A lot of the concerns, too, Mark, are people wonder what this means for folks on Medicaid. And a lot of those people are some of the most vulnerable in our society. There are some concerns what the future could hold for those folks if this passes in its current form.
Right. In its current form, there are going to be limits on Medicaid. And that's what the moderate Republicans are afraid of. Conservative Republicans think that should be limited even further, and they think there should be other ways to handle that, apart from medical or health insurance or health care. They think there's a different, separate way to handle that problem.
Well, the White House is hoping to get this through the House by April. Then it moves on to the Senate. We shall see. A long way to go.
Long way to go. Lots of amendments.
Yeah, between now and there. Marc Clauson, thank you so much.
Thank you.
For enlightening us on a very complex issue. Brooke, over to you.